Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh. And good morning. Uh, I would like to thanks the organizer for inviting me to involve in this bioethics course again, and I would like to welcome all the participants for this bioethics course for this year. I was given the task to deliver the topic of doctor-patient communication and counselling. Okay, this is actually the third year for me deliver this topic, and I hope it will give some information regarding our communication with our patient. Okay, why the communication between doctor patient is very important? Because with a good communication, we can facilitate for an accurate diagnosis, and when we get the diagnosis, we can counsel the patient appropriately regarding the diagnosis, and also can give advice in terms of the therapeutic instruction to the patient. And also we can establish a good therapeutic relationship with the patient, because the ultimate goal for the doctor-patient communication is to improve the patient's health and medical care. We sometimes heard some comments from the patient that when they come to see the doctor, they are not very satisfied with doctor. Maybe because of part of the communication is not good or not appropriate during the clinic session. So with this topic, hopefully we can reassess ourselves and also relearn regarding the communication technique. Okay, many studies found out that the effective communication between doctors and the patient is important, because it can improve the symptoms. For example, in terms of blood sugar control, blood pressure control, also can improve the pain. Okay, and of course, when the symptoms improve, it will also improve the daily functioning of the patient. The good communication also can give effect on the emotional health of the patient. For example, with a good communication, good explanation, so the anxiety of a patient can be reduced, and also can improve the distress or negative emotion of the patient. And of course, a good communication between the doctor and the patient is for the treatment adherence. It can enhance the treatment adherence. Even though the doctor-patient communication supposed to be our natural skills, but actually we need to learn about this, because studies done by this author found out year by year there are deterioration of doctors' communication skills. So we need to relearn the communication skill. Don't think that our communication skill is good for all the time. Maybe we can improve, and we can make it suitable for each patient or each situation. Some problem in the communication between the doctor-patient is, one is because of non-disclosure of the information. Some of the doctors maybe hide some information and not telling the full information to the patient, maybe because of some issue, ethical issue, or emotional issue. Then the doctors also show some avoidance behavior. They maybe they don't want to discuss, or they are not discussing some issue, especially involving the emotional or social impact of the patients. For example, breaking bad news. Some of the doctors maybe try to avoid this and hand the task to other colleagues to disclose this. Another problem is discouragement of collaboration. Some of the technique applied by the doctors is about I mean that only one-way communication. There is no rooms for the patient to discuss, or the doctors does not invite the patient to discuss during the clinic session. And of course, another problem that is important is resistance by the patient. How good of the doctors in the communication, but if the patient have some resistance, not very cooperative, refuse to follow, so it also will interfere with the doctor-patient communication. Okay. Based on SARS and Hollander, this is an old theory in 1956. They came out with three models of the doctor-patient relationship. Okay, so we can imagine which model that we always apply when we meet our patient. It doesn't mean that one model is more superior or better than other model, because we choose this model is based on the situations when we treat the patient. The first model is activity passivity model. This is like parents infant way of communication, where the doctor do everything to the patient, and the patient just accept whatever the doctor do. And this model usually apply in the case of comatose patient, in the acute trauma, where the patient unable to give any decision, or only receive whatever treatment given by the doctor. The second model is the guidance cooperation model. This is like the parents and adolescent communication, where the doctor tell the patients what to do, and the patients will do based on the suggestion by the doctor. And the situation that suitable to apply this model is like in acute infection, when the doctor explain to the patient what to do, how many times to take the medication, how to take the medication, and all the suggestion will be carried out by the patient. The third model is the mutual participation, and this is the adult communication, where the physician only just give some guidance, and the patients will elaborate what the technique or the ways that can be done by the patient themselves. For example, in the psychotherapy session, when we just like the doctor like just trigger something, and the patient will elaborate regarding that situation. So this is the three models of the doctor-patient relationship. Okay, when preparing these slides, so I tried to find out which doctor-patient communication model that can be used as our guideline. And I came across this guideline. The name is the Massey model of doctor-patient communication, published by Kale et al. In 2004. Actually, this guideline is the collaboration between three universities: New York University, Case Western, and also University of Massachusetts, when they want to develop a curriculum regarding the communication. See how important of the communication, because until these three universities sit together to prepare a guideline of the communication skills. And this the Massey model illustrate the process of the communication when the patient when the doctor meet the patient, from the beginning until the end of the session. We will go one by one the process in this model. Okay. the function of the medical interview based on this Macy model is to identify the problem. Okay, so we understand when we want to identify the problem, we will get the detailed history. We observe the data, for example, investigation results. Then we maybe we do some skills or questionnaire for the patient, and also we identify the psychosocial and other contextual variable. Means that not only related to the symptoms, but also other history that is might be relevant to the patient's condition. Okay, besides identifying the problem, during the interview also we need to develop and maintain a relationship. Okay, this is important because the doctor also should have the skills to develop and maintain relationship. For example, we involve the patient in the discussion, ask about their perspective regarding the symptoms, show the empathy, demonstrate the professionalism during the interview, have good skills in the listening skill, questioning skills, and other skills. So this is part of the to have a good relationship with the patient. And in the interview itself also there is a part of education and counseling, because we when we see a patient, we cannot run away from giving education or counseling to the patient. Maybe it will take only 1 to 2 minutes just to educate the patient regarding the importance of taking medication of other treatment. Okay, so in one setting, in when we see a patient, these three situation needs to be included in the discussion with the patient. Even though we see the patient for 5 minutes, 10 minutes, or 30 minutes, so need to include identifying problem, having a good relationship, and also end up with the education for the patient. Okay, this is what I said, that the process based on the Macy model. There are 8 process. Okay, imagine that we see a patient, okay, in our outpatient clinic. It will start with the prepare. Prepare means that before the patient enter the room to see the doctor, what we need to do during the preparation process. Then when the patient come into the room, we start to open the discussion with the patient. Next step is the gather information. Okay. Then in between, we ask regarding the patient's understanding, or we ask the patient's expectation, the patient's perspective regarding the symptoms, and we proceed with the maybe the physical examination or other examination lah. Also need to have some communication during this physical examination. And next part is after we finish, maybe after we get the diagnosis of the patient, so we can move to the patient's education and counseling. And after that, we give sometimes in terms of a negotiation with the patient, because in the treatment, it's supposed to be the shared decision making. So we negotiate with the patient whether the patient agree of the plan. Maybe the patient have problem, logistic problem, or a financial problem. So we can discuss again regarding the management with the patient. And lastly, before the patient go out from our room, so we need to close the session with the patient. So this is the 8 process when we see a patient in our clinic. We need to go one by one. Okay. Okay, the fundamental skills during the interview. What the doctors need to show is the relationship building. Okay, so this is the part where the doctor need to have some skills. As I mentioned just now, one is the skills of hearing skills. When the patient tell you all the story, so you need to have a good hearing skill technique. Okay. The second is the skill to ask question. Okay. we need to understand or know which part that we need to ask the open-ended question, close-ended question, a sensitive issue, how to ask about sensitive issue. So doctor also need to learn about this skill. The third skill is the observation skills. During the interview, when the patient sit in front of us, when talking to the patient, we also need to observe the patient, observe their body language, observe their facial expression. So with this good observation technique, so it also can help in terms of discussion with the patient later. And lastly is the skills in giving the reflection. We see the facial expression of the patient. We see how the patients answer the question. So we can give some reflection regarding what the patients tell us or the patient's behavior. And during the interview also, the doctor need to manage the flow, need to be organized, starting from the preparation, develop the rapport during the opening session, then gather information during the physical examination, giving the education, discussion about the plan, and also the close of the session. So it should maintain in the flow of the discussion or flow of this model lah. Okay, eight process. Okay, the first process is prepare. Okay, this will be done by the doctor before the patient enter the room. Okay, imagine now we can imagine the usual way that we see the patient in our clinic. When we enter the clinic, we enter the treatment room. Of course, we will see a few folders already in our table. Okay, so before we call the patient in, so we need to go through the patient's folder. Okay, maybe we can get some idea regarding the diagnosis. Okay, if there is the follow-up patient lah, regarding the diagnosis, what the management of the patient, any new investigation was done during the last TCA, and we review the results. So this will help us in terms of managing the time when the patient come into our room later. Okay, this is the main comment from the patient, because we when the patient come into the clinic, the patient most probably will see different doctors for each TCA. So the patient will complain that they need to give history again and again when they meet the different doctor during the TCA. So while doing some preparation before the patient enter the room, so it will give some what I can say can make the patient comfortable. Okay, patient don't need to repeat the same story again and again as commented before lah. Okay. Then before we see the patient, we also need to have to control ourselves. Okay, maybe before we come to the clinic, we do walk round, and we was scolded by our specialist maybe lah. So we when we come to the clinic, we supposed to be free from that feeling. Okay, so leave it because that is nothing to do with our patient at the clinic. So don't be biased. If we see the name of the patients that we know this patient, maybe we heard that this patient is a complicated case or difficult patient. So don't be biased before we see the patient. Be it natural, because the bias before seeing the patient will interfere with the good communication between the doctor and the patient later. Okay, next, okay, we call the patient in, okay? Then the patient sit down, okay? During the opening session, this is the time that we need to develop the rapport with the patient, okay? It won't take long, maybe 2-3 minutes just to develop the rapport. Ask the patient, okay, Assalamualaikum, good morning, how are you today? Okay, how to develop the rapport? It is need to be suitable for certain patient lah. Okay, if you see an adult patient, so maybe you can call by their name. Okay, ask them how are you today. Okay, anything bother you before you come to the hospital. When if you see child case, okay, maybe you need to change the approach. Okay, as okay, oh nama apa, sekolah dekat mana, dah makan ke belum. So the way that we approach the patient to develop rapport is based on the patient. Okay, and try to observe whether the patient is comfortable or not lah. Maybe patient in pain or patient not comfortable because there are a few medical students in the room. This is where we apply the observation technique. Okay, it is only a short period developing the rapport. Okay, before we proceed to asking about the main reason or the symptoms. Okay, this is the main part of our meeting with the patient lah, gathering information, especially for those new case, the first time come to us. Okay, we gather information and when gathering the information, we also need to have some techniques. Otherwise, we maybe the patient started to become uncooperative or hiding some information because they feel that this patient is not very helpful, or this doctor is not very helpful, or this doctor maybe is not appreciate their story. So we need to maintain the relationship between with our patient during this time. Okay, when gathering the information, we need to apply some open-ended question, sometimes close-ended question. Open-ended question like asking the patient, and the patient needs to elaborate. Okay, how are you today? Okay, what do you how do you feel? Okay, so the patient needs to describe or elaborate. A close-ended, for example, do you have pain in your stomach? Do you have headache? Your headache is at the frontal region or at the central. So that is the close-ended, where the patient just need to answer yes or no, or specific answer. And besides asking the question, we also need to invite the patient to tell their story. And when the patient started to talk, so we need to have a good listening skill. Okay, to show that we are listening to the patient seriously. We are concerned about their problem. Okay, try to not disturb too much when the patient started to elaborate or tell their story. Okay, use verbal and non-verbal encouragement. Okay, you can ask the patient to tell more about this. Okay, can you tell more lagi, or you can use non-verbal sign. Okay, like some hand punya gesture to ask the patient to elaborate more about their story. And then when the patient finish, okay, we define the symptoms, okay, and determine the main concern. We try to summarize the patient's problem. Okay, and because this is important, to show that the doctor is listening to the patient. The doctor concerned regarding the patient's complaint. Okay. At the end of the gathering the information, we can summarize. Okay. Okay. So what I understand that your main concern is about your headache. Okay, and this is occur for years already. And you come today because you unable to stand it anymore. Okay, so we just summarize whatever the problem given by the patient. Okay. Okay, next step is the elicit and understanding the patient's perspective. Yeah. Okay. Just now we gather all the information regarding the patient's problem. Okay. Now we ask the patients regarding what their understanding, okay, or what they know about their problem. Okay. I give my example because I'm dealing with a child and adolescent. Okay. When the parents bring their patients with the complaint of speech delay, okay, and when I elicit the symptoms that it might be autism spectrum disorder, so I will ask the parents, okay, do you think that your child having some problem? Okay. Uh, if they said yes, okay, do you think that what kind of problem that your child might have? Okay, because some parents of some patients already do some search, okay, regarding their symptoms. So whether their understanding is similar to actually what is the real thing happen, or maybe they have a misunderstanding about their symptoms. So that's why important for us to get the patient's perspective regarding their problem. Okay, ask about their expectation. So why you come today? You have the problem for years already, but only today that you come. Maybe the patient have a problem at work. He get a warning from the superior for frequent MCs. So. Uh, or because they need the second opinion. So we ask what are the expectations from the patient. Okay, we explore the belief. We ask about the family. Okay, ask about other contexts besides the symptoms. How about the family understanding, the family support? Okay, how about your friends? Are they believe in, about your story? Okay. Next is acknowledge and response to patients' concern, feelings, and non-verbal cues. Okay, we verbally or non-verbally, we need to show that we are concerned. We acknowledge their problem. Okay, some of us maybe not a belief. Okay, we difficult to believe what the patients tell us, or maybe the patients tell us something is wrong. Okay, so we try not to show that we are reject their story or reject their or opinion. Try to not show in front of the patient. Okay. Some patient will also complain. Maybe at the beginning of the session, they complain of, okay, I'm waiting for 2 hours already. Okay, nobody answer my question when the doctor will see me. So we cannot just leave it like that. Try to acknowledge their frustration, validate their frustration. Maybe okay, because I'm the only specialist for this area, so I have something to do. I have to settle something in the ward. So I'm sorry for. Because you need to wait. Okay, so we acknowledge the frustration. Don't just leave it the patient with their own frustration. Okay, next is the communicate during the examination of the procedure. Okay, after we gather the information, maybe we want to proceed with some physical examination. Okay, don't just keep quiet during conducting the physical examination. Communicate with the patient, give a good instruction, explanation. Okay, now I want to do some examination, and can you lie on the bed? I need to open up your shirt bead. Okay, okay. When we do the examination, if we find something, so tell the patient during the time. Okay, looks like your the pain is at the right side of your stomach. Okay, maybe so we have during the physical examination there is no silent period. Still communicate with the patient and observe the patient during the physical examination to avoid pain. Okay, while we touch the patient. Okay. Uh, Okay, after finish taking the history and do the physical examination, then we make the diagnosis of the patient, and then we proceed with the patient education. We cannot, patient cannot go out from our room without any medical education or with confusion. Okay. Uh, when we give the patients treatment or medication, so we need to explain. I give you these three types of medication. Okay, especially for those who first time come to see the doctor. Okay. Okay, while giving the education, so again we discuss the patient with the technique of ask, tell, ask. Okay, we ask the patient. Okay, their understanding, whether they able to follow the instruction given, follow the management plan. Okay, then we tell the patient why you need to take this medication. Okay, why you need to take until 3 times daily. Okay, how long you need to take this medication, and ask again whether the patients understand or not regarding the instruction or any other difficulties. Okay, in terms of the management. Okay. Um, tell the information clearly and concisely. Okay, because we also need to adjust our time. Okay, because we need to see patients later. Maybe many patients is waiting, so the information should be very clear and concise. Okay. Uh, Ask repeatedly for patients understanding. This is very important because some of the patients we already explained, and but when they come to the next TCA, they looks like not understand or don't know about the management plan. Okay, so the doctor maybe have some misunderstanding that the previous doctor did not give a good medical education or a therapeutic education to the patient. So that's why we need to ask the patient's understanding after we finish giving counseling or education. We can use aids to enhance understanding. For example, in neuro, we can use the a brain diagram. Okay. So the patients will be more understand about the problem, and encourage the question. Always ask the patient if there are any questions from the patient before the patient leave the room. Okay, and try to answer the questions. Okay. Negotiate and agree on the plan. Okay, when we set our management plan, okay, some we cannot it should be the shared decision making. This is the current trend of the management with the patient, the shared decision making, whether the patient can follow our plan coming to the clinic 2 weekly, taking the medication 3 times. Okay, a few medications need to take at one time. So whether the patient can follow this. Maybe the patient stay far away, so they cannot come to the hospital very frequent. Okay, So with this problem, maybe we can refer to the nearest clinic. Okay, they have the financial problem, maybe. Okay, they don't have the support. They have some memory problem. Okay, to remember all the time of taking medication. So this need to be considered. That's why if the patients or relative have some problem, so we try to discuss with them how to adjust the management if we can. If we cannot, so we need to explain the patients or relative that this is the only way in the management of the problem. Okay, and suppose the family or patient will be understand about this. Okay, elicit the understanding, concern. Okay, as usual. Okay, again and again, we ask about the their understanding. Check the patient's willingness and ability to follow the plan. Okay, as I mentioned just now, and identify and enlist resources and support. If they have the logistic problem, so we can suggest which a clinic or hospital that nearest to their hometown. Okay, if they have some financial problem, if we know where the patients can ask for the financial aid, so this kind of support that we can give to the patient, even though the patient is the follow-up case, we always follow these steps. And lastly, before the patient go out, some patient like to talk to the doctor because maybe the doctor is a good in terms of delivering the education, a good communication. So and we have a few more patients to see. So we need to give a sign regarding the finish of the session. Okay, we can tell the patient, okay, that's all. Okay, if anything else we can discuss during the next TCA. So that is the sign that actually the patient needs to go and we need to see another patient after this. Okay. Summarize and verify assessment and plan. Okay, we already did during the previous process. Okay, assure plan for unexpected and follow up. Okay, basically during the close session, we just summarize again. Okay, so I hope that you can follow all the plan. Okay, and don't try to take the medication. Try to be compliant with the medication. If you have any problems, you can discuss with me during the next TCA. So that is the if the patient understand that means that the session with the doctor is come into the end. Okay, and if possible, we can stand up and open the door for the patient. This is the really sign that the patient needs to go. It happens sometimes that the patient have difficulty to go out because they like to talk. Okay, so that are the basic communication skills. Okay, I summarize regarding the communication, doctor-patient communication. We follow the MESI guideline. There are 8 process during the meeting with a patient. Okay, starting from prepare, open, gathering information. Okay, then communication during physical examination, patient education, negotiation of the plan, and also close the session with the patient. Okay, and during the communication we need to have some skills. Okay, listening skills, asking question skills, observation skills, and also reflecting. Give skills in giving reflection. So if you think that you are lacking about this knowledge, so maybe we can do some reading regarding these skills. We can find anywhere in the internet regarding these types of skills, communication skills. Okay, next is about the counselling. Okay, the counselling is I supposed to be not most appropriate person to talk about the counselling, because psychiatry and counsellor is a different field. But I try to give some basic knowledge regarding the counselling. Okay, because we are not want to be a counselor, but we just want to give some counseling when we see our patient. Okay, counseling is a talking therapy. Talking therapy involve a trained therapist listening to clients and helping them find ways to deal with emotional issue. This is based on UK's national health system. Okay, actually this is just talking. Okay, and the person, the therapist should be trained. Okay, train doesn't mean that is qualified, but we learn something about that. We have some background how to give the technique of counseling, so that can be considered as trained lah. Okay. Okay, so I mentioned about the skills today. So the participants is considered as a trained. Okay, listening to the clients and helping them find ways to deal with emotional. We just help the clients. We are not doing something to them. It is not the activity passivity punya relationship model. Okay. This is the mutual participation. Okay, we just help and they will come up with their own idea how to solve their own problem. Counseling is a process, so it cannot be complete in one session. It is the process. Okay, the act of helping the clients to see things more clearly, possibly from a different point of viewpoint. We just trigger what something that the patient needs to do or the problem, and the client will elaborate about this. For example, okay, we just give some trigger. Okay, do you think that your family is not very supportive? Okay, so with this question, the client will started to elaborate, will tell us the real thing about their family. Okay, actually means that there is something the real happen, as what we ask the patient. And the counseling is a relationship of trust. Okay, if there is no trust between the client and the therapist, so the counseling session is not won't achieve a good outcome. Okay, it must be trust, because if no trust from the client, so they will not tell us everything, or not tell us the truth regarding this. So it is will disturb the counseling session. Counseling is not giving advice. Okay, we just listen to the patient's problem, just trigger, and they will come up with their own idea, their own plan. Okay, not giving advice. Counseling is not being judgmental. We cannot give a remark to the patient. Okay, or this is not the way. Okay, for example, okay, I think you are doing something wrong. Okay, so this is very judgmental. Okay, so it is not supposed to be in the counseling session. Counseling is not attempting to sort out the problem. Okay, we when the client come for the counseling session, it is just to find ways for their problem. Okay, what they can do. Okay, if the first alternative is not helpful, so what are the alternatives that they can be done? They can be done to improve the problem. So this is not about the sort out the problem. Okay. Counseling is not expecting or encouraging a client behave as the counselor would behave if confronted with a similar problem in their own life. Okay, the therapist cannot be biased. Okay, the therapy cannot be have some idea in mind that you should do like this, you should do like this. If I at your place, okay, I will do this. So that not supposed to be mentioned by the therapist, because we want the client to come up with their own plan, with their own decision. Okay. Counseling is not getting emotionally involved with the client. We also, in terms of emotion, we need to be neutral. Cannot be too involved. Okay, oh kesiannya, until we looks like macam agree whatever the clients tell us. Okay. And counseling is not looking at the client's problem from the therapist's own perspective. Sometimes the problem faced by the client almost similar to the therapist. So this is not the time where the therapist tell the patient that based on the therapist's experience. I also have the same problem with you previously. Okay, that is not the way. It's not. Okay. So even though the therapist have almost similar problem with the client, try to be biased. Try not to mention that. Try not to be strict to their experience. Let the clients come up with their own. Okay, this is the skills in the counseling. Okay, just now in the communication, okay, four basic things. Listening, asking question, observation, and also the giving reflection. In the counseling, there are how many? Dua, empat, enam. Okay, 8 skills. Okay. Some of the skills also included in the communication skills. Attending the patient, reflecting and rephrasing, summarizing, questioning, focusing, immediacy, building rapport, and silence. Okay. Okay, I will go briefly one by one regarding the skills. Okay, the first one is attending. Attending is when the patient started to come in front of us lah. Okay, give full attention to the client on what they are saying or doing. Okay. To show that we are very concerned, we are listening to the patient. Don't do something else. If we want to jot down something, so tell us, okay? Okay, before. During the session, okay, I will write something, okay? So it won't interfere me from listening to your problem, okay? So that is attending the patient. Okay. Otherwise, the client will be feeling uncomfortable because the doctor maybe seeing the handphone ke, reply the WhatsApp ke. So that not supposed to be done in the counseling session. If it is very urgent, so ask the permission. Okay, I'm sorry, I need to answer this call because this is very urgent. I'm on call today. Okay, so tell the patient. Okay, the second is the silent technique. Okay. Silent also need to be technique. Sometimes we cannot be patient with the client because client is talking is very slow, okay, but not answering question, have a long pause. But the silence is also one of the skills during the counseling session. If we keep asking the question when the patient pause, so it will avoid the patient from elaborate the issue. Give the clients control the content, pace, and objective. Don't be a rush to asking the question. Okay, the third technique is reflecting and rephrasing to make sure the clients know their story is being listened. Okay, we maybe we can interrupt, okay, to show that we are listening, we are understanding, and at the end of the story, so we can rephrase. Okay, so you mean that you have problem with your wife. Okay, so that is rephrasing. Okay, next is the questioning technique. Okay, as I mentioned, during the communication skills, open-ended, close-ended, clarify the understanding. Okay. Focusing. Focusing involves making decision about what issue the client wants to deal with and concentrate on the central issue of concern. Okay. When sometimes the patient, the client tell a few things in one session, okay, that we think that this is not the main concern, okay, so we can bring back the patient to the real problem, okay. Okay. uh, okay, just now I think the most important problem that you experience is about your children. Okay, let's talk about your children. Okay, when we think that the patient is out of the main topic, so we can bring the patient back to the main concern. Okay, that is focusing. Building rapport, yes, verbally, non-verbal, okay. Uh, uh, Appropriate way to build the rapport, okay. Uh, sum up the main themes that are emerging, okay. Summarizing at the end of the session, maybe you can give a few points that most concerned by the patient, okay, and summarize what it actually discussed during the session, okay. And the immediacy ni, this is important for a good observation technique, okay, because during the session with the client, sometimes the client unintentionally come up with some inappropriate behavior, okay, ataupun telling something that is not tally with what the patient's punya feeling. For example, like this example, okay, maybe when talking to the doctor or therapist, the client started to increase the tone of the voice, okay. uh, uh, so we can highlight this, okay. I noticed that when you talk to me, you looks like angry, okay. Do you have any significant? Do you want to express something? Maybe the therapist is looks like the husband of the client. So the client want to transfer their anger to the client unintentionally, to transfer the anger to the husband. But unintentionally to the therapist lah. So we can highlight this with this is called immediacy. So don't need to wait until the end of the session. We can interrupt the patient. Okay, why you looks sad when you talk about your late father. Okay, maybe there is some significant story behind this behavior. So that is the immediacy. Okay, how to use effective counseling skills. Okay, so there are 8 skills. Okay, in the counseling. Uh, the therapist need to be genuine. If you don't understand, it's okay to check and ask for further information. Okay, because the patient will come with various problem. Okay, okay, and various way of expressing the problem. Okay, different behavior. So we need to manage the patient differently. Be genuine. Don't be so biased. Don't give a fake understanding or fake emotion when dealing with the patient. Try to be brief when reflecting back, okay. Because the session is for the counseling, the maximum is about 1 hour. The session is usually 45 minutes to 1 hour. So we allow the patient to elaborate all the symptoms. We need to have the time to reflect or to summarize. So the reflection need to be very brief. Use own words to reflect back. Don't just repeat the patient's word. Use our own word that indicate that we are analyzing the patient's problem, and avoid using a shock or disbelief tone of voice. Okay, try to be neutral. I don't think it is true. Okay, so this with this word, it will straight away disturb the communication with our client. Okay, so avoid using a shock or disbelief tone of voice. Okay, so I think that's all regarding the counseling skills. Okay, so for the summary with this topic, so I deliver two things. One is about the patient's doctor patient's communication, and using the Messi guideline, and also the skills in counseling. So hope it will give some information for you all, and if you need a further information about this, you can refer to any information in the internet regarding this skill. So it is widely available anywhere. Okay, thank you. Assalamualaikum warahmatullahi taala wabarakatuh.